Hello all, this is One Minute Solution and today we are going to talk about the allergic conjunctivitis, their types and what are the etiology for the allergic conjunctivitis, also the pathological causes, signs and symptoms, and also we are going to see about the treatment for the types of allergic conjunctivitis. First, we will move on to the definition. So, what is allergic conjunctivitis? So, in the definition, we can see it is an inflammation of the conjunctiva. It is due to allergic or an hypersensitivity reaction. And this hypersensitivity reaction may be immediate or a delayed type of hypersensitivity reaction. And if you see, the conjunctiva is 10 times more sensitive to dust than the skin. Now we are going to see the types of allergic conjunctivitis. So we have simple allergic conjunctivitis, vernal keratoconjunctivitis, atopic keratoconjunctivitis, giant papillary conjunctivitis, plytenular keratoconjunctivitis, and dermatoconjunctivitis. And this vernal keratoconjunctivitis is also called as VKC, and atopic keratoconjunctivitis is also known as AKC. Okay. Now we will see the types. Simple allergic conjunctivitis is divided into seasonal and perennial. It is acute type. During the particular season, we will be exposing to the dust or the allergen. And if you see the perennial, it is the house dust or the mite. That is a chronic exposure. And if you see, the seasonal is also associated with hay fever, that is called as hay fever conjunctivitis. Now we will be seeing the etiology. So it is mainly caused due to type 1 hypersensitivity reaction, that is IgE mediated, and which causes mast cell activation of the IgE, and what will happen, and it will lead to degranulation of the mast cells. Now we will see the pathological causes. We will see the three responses in our body. So what will happen when we expose to an allergen? The vascular, cellular and conjunctival response we can see. So what we will see in the vascular response, we have a vasodilatation. Cellular, we have eosinophil, plasma cell, mast cell and histamine will be released out. And we will be also having the conjunctival response. Now we are moving on to the signs and symptoms. First we will be seeing the symptoms, that is we have intense itching when we expose to a dust, burning sensation, watery, mucus, and we have a stringy discharge. And we will be having a mild photophobia too. Now we are moving on to the sign, that is hyperemia can occur, chemosis, edema of the lids, and that is chemosis here, redness of the eye conjunctiva. Treatment, we have to first remove the patient from the exposure. Then we are going to give a cold compression. Also, we are going to give a topical vasoconstrictor. Why we are giving vasoconstrictor? We already saw vascular response. We have a vasodilatation. So, to avoid that, we are going to give a topical vasoconstrictor. For example, nafazolin, tetrahydrozolin. And we are also going to give a mast cell stabilizer, NSAID, that is your ketorolac and diclofenac, and your steroids. So these are the 6 important treatment that you are going to give the patient. Okay. Next we are moving on to the, now we will be moving to vernal keratoconjunctivitis, and it is usually bilateral in nature and it is also known as pink cataract, and it is usually recurrent, bilateral, and also it is self-limiting conjunctivitis. Now etiology, it is also caused by type 1 hypersensitivity reaction, but it is not IgE mediated. It is Th2 lymphocyte alteration. This conjunctivitis will occur. And now we will be seeing the predisposing factors for this conjunctivitis. That is, it usually occurs from the age group of 4 to 20 years and it's most commonly seen in boys. And if you see the season, it mostly occur in summer season. That is, it is also known as warm weather conjunctivitis. Now, next we will be seeing the eczema and asthma associated VKC will be 40 to 75%, and if the family history is present, then 40 to 60% of the person can get the VKC. Okay, now we are moving on to the symptoms of the VKC. So what are the symptoms we can see? We can see marked burning sensation, itching sensation, mild photophobia, lacrimation, and also your stringy ropey discharge. We already seen the same features in simple allergic conjunctivitis. Okay, and we can also see the heaviness of the lids. Now we will be seeing about the signs. So what are the signs that we can see is, one, you have the three forms. One is your palpebral form, bulbar, limbal form, and your mixed form. So first we are going to see the signs of palpebral form. We will have upper tarsal conjunctiva of the both eye is the palpebral form, and what we get here is your papillae hypertrophy, that is your giant papillae will occur, and also it is seen as cobblestone or pavement stone appearance, and you will see a white ropey discharge. Next we have bulbar limbal form. So bulbar limbal form, you will see a dusky red triangular congestion and whitish raised dots can be seen. That is known as Horner-Tranda spots. So two things you have to remember. One is your cobblestone appearance and one more is your Horner-Tranda spots. That is at your bulbar level and cobblestone is at your palpebral level, and mixed is the combination of the both. Okay, and then we have corneal involvement also seen in the primary or the secondary level, and it is most frequent with the palpebral form. What will happen? There will be a formation of punctate epithelial ulceration at the upper cornea, and this can be strained with the help of rose bengal in fluorescent dye. Okay, and we will be having frank epithelial erosion, and you can see the Bowman's membrane will be intact at the presence. It is due to the punctate epithelial lesion, and we will be also seeing the ulcerative vernal keratoconjunctivitis if the conjunctivitis progresses for a very common period of time, and we will be having shield ulceration, that is your shallow transverse upper part of cornea will be involved, that is your shield ulceration, and it can be treated by surgical keratectomy. Okay, you will also see the scarring will be ring scar. It's a form of ring scar at the subepithelium present, and we will also have a recurrent limbus disease, that is called as Cupid's bow outline. It is, and if you see the differential diagnosis for VKC, that is your trachoma with predominantly papillary hypertrophy and also your AKC. Okay, and in the palpebral form, I told you a hypertrophy will be there, that is your giant hypertrophy, that is also seen in trachoma. So these are the differential diagnosis for VKC. Okay, so you have to remember two things. One is your cobblestone appearance. Next is your Horner-Tranda spots. Okay, so these are the two things you have to remember. Now we are going to see the extra points, that is your Denny Morgan sign. That is a continuous fold below the eye is called as Denny Morgan sign, and Hertog's sign is nothing but your lateral part of the eyebrow will be absent. Now we are going to see the treatment for the same. What we are going to give? We are going to give a topical steroids, and we can get steroid induced cataract, and we have to regularly check with IOP if we give steroids. Then we can give fluoromethazone, betamethasone in the steroid group. Next we have mast cell stabilizer, NSAID, topical cyclosporin, and your tacrolimus, which is a immunomodulators. So these are the some of the things, and we can give lubricating eye drops, that is your cellulose and your acetylcysteine. Okay, so these are the treatment for your vernal keratoconjunctivitis and important features for vernal keratoconjunctivitis. Okay, now we will be moving on to the AKC. Now we will be talking about atopic keratoconjunctivitis, that is your AKC, and it is usually caused by type 1 and as well as type 4 hypersensitivity reaction. Now we are going to see the symptoms of the AKC. First we will be seeing itching, soreness, dry sensation. Here you will be seeing the mucoid discharge, photophobia, and you will be having the blurred vision. If you see the signs, we will be having the Denny-Morgan sign. We already saw what is Denny-Morgan sign. It is the continuous fold below the eye. Okay. And what is Hertog sign? Hertog sign is the absence of the lateral part of the eyebrow. Okay. So giant papillary conjunctivitis is mainly due to mechanical force, that is your contact lens, prosthesis, exposed nylon sutures, and other causes for giant papillary conjunctivitis. Exact pathogenesis is not known for giant papillary conjunctivitis. If you see the symptoms, the same symptoms, irritation, itching, and stringy discharge can be seen. And what are the signs we see? We will be seeing the papillary hypertrophy, that is 0.6 mm to 1.75 mm at the upper tarsal conjunctiva, similar to what? Similar to VKC. We already saw in VKC we will be having papillary hypertrophy. The same thing will be seen in the giant cell too. And what are the treatment we can give? We can give a offending cause removal, that is your contact, or it is due to the nylon suture, it have to be removed immediately. After removing it, we can give antihistaminic, steroids, mast cell stabilizer such as sodium chromoglycate. Next, we are moving on to the last one, that is your plytenular keratoconjunctivitis. It is unilateral. I told you VKC is bilateral. Plytenular is unilateral. Okay, always unilateral. So what does Plyton means? Plyton means it is allergic at response to conjunctival and corneal epithelium. Okay, there is a endogenous microbial proteins that are present. That is why it is called as microbial allergic conjunctivitis. And it is mainly due to the type 4 hypersensitivity reaction. For example, your TB, staphylococcus infection, all these causes. And if you see, females are more prone for plytenular keratoconjunctivitis, that too from 3 to 15 years of age, who is undernourished or who lives in an overcrowded area can easily acquire the plytenular keratoconjunctivitis. And signs, if you see, it is simple, necrotizing, fascicular, and miliary types of cells can be seen. Treatment, the same for the giant papillary conjunctivitis. You will also remove the what are the causes that leading to the plytenular keratoconjunctivitis, and also other things. And at last we have contact dermoconjunctivitis. It is also due to type 4 hypersensitivity reaction. And what are the differential diagnoses for plytenular keratoconjunctivitis? That is your episcleritis, scleritis, conjunctival foreign body, and your granuloma. So these are the differential diagnoses for plytenular conjunctivitis. And what are the differential diagnoses for VKC? I already told you in the. That's all. I have discussed all the types of allergic conjunctivitis, and see you in the next video. Thank you.